All right, so now we're gonna look at pulmonary function tests, right? So you remember going to the doctor after all the different checkups you do, the first thing he says, he grabs a little tube and tells you to blow in it, right? So you're supposed to grab it, put it next to your mouth, then as you go, exhale as hard as you can, right? Some of you always look at the little clip thing with the measurements and you're like, okay, I want to get it all the way to the end, right? It's not necessarily always a good thing, right? But they want to do it and then you start coughing. So this is the test I'm talking about, right? So what is that test called? It's called a spirometer. So a spirometer is a device that is used to measure the vital capacity of the actual volume of gas that's present in your lungs, right? So spirometer is what's used, right? And so the way we do these different kind of measurements, the reason why for this is because we want to see if there is some kind of abnormality, right? So if you have certain symptoms of pulmonary abnormalities like dyspnea, troubleness breathing, shortness of breath, what else? Sweating, right? So you can't breathe no more, right? So you want to figure out, do I have a condition, right? So there's two types of conditions. There's obstructive and there's restrictive conditions, right? So we talked about obstructive conditions like when there's a high compliance, right? Or there's a problem with the passageway of the lungs. For example, we talked about emphysema before. And then restrictive is the inability for the lungs to expand properly, right? So due to the increase in elastance, and that could be an example of certain kinds of fibrosis, right? Pulmonary fibrosis. Very common is an interstitial pulmonary disease called idiopathic pulmonary fibrosis, right? And so the way they're measured is through these ratios that are based off of looking at the comparison. So you have forced, expiratory, volume, 1, right? So you see this one length here. This is the total amount of actual fluid being released out of your lungs, gas being released out of your lungs in 1 second, right? So this is 1 second, all of the gas that's being released out, right? And then you have another phenomenon here called force vital capacity, right? So based off of these ratios, right? So this is the total amount of gas that is possibly being expelled out, right? And so these ratios create a phenomenon where you can distinguish whether there's an abnormality or everything is fine, good to go, you can leave and you're wasting the doctor's time, right? And so certain of these common obstructive pulmonary diseases lead to the abnormality of these ratios, right? And this can be easily detected based off of this ratio and this measurements, right? And so when we look at these ratios here, the normal ratio when it comes out for normal ratio is about 0.8. So anybody that has 0.8 measured of these ratios, this is considered normal, right? Anything less, so less than 0.8, this is where you have an obstructive problem, right? So there's some kind of obstructive problem. So what was an example of obstructive that we talked about before? A lot of COPD. So COPDs, chronic obstructive pulmonary diseases like chronic bronchitis, emphysema, these measurements after the spirometer is generated, right? So you use this device to create this ratio. You can now conclude based off of a function test, right? So we're not just looking at anatomy here, we're looking at physiology, that there is some kind of chronic obstructive pathway because you have an obstructive disease, right? So usually below 0.8, and then anything greater than 0.8, these are known as restrictive diseases. So restrictive conditions where it's difficulty for the inspiration to take place, right? So an example of are these interstitial pulmonary diseases. So the interstitial diseases where you have pulmonary problems involving a lack of a very high level of elastance, right? So an example of this was that we talked about in the beginning of the video was idiopathic pulmonary fibrosis. So this is a type of fibrosis where we don't know the actual cause of it. They're still figuring that problem out, but this can be detected using this spirometer. And now, based off of these, you can do further examinations, right? So you can do, for example, some kind of CT scan or MRI to see what the problem is, what the obstruction is, right? So obstructive diseases, there's a wide variety of them, right? So chronic obstructive disease, it could be one, or if the number is much greater than 0.8, this can be a restrictive condition, which can lead to a high variety of conditions. And so the next step after this physiological abnormality is to look at more of the anatomy and maybe even the histology to give a proper diagnosis for treatment.